Spectrum has publicly committed to reducing medical error 75% over the next 3 years. Now that's a real metric. Or how about number 3, a 50% reduction in unexplained variation in your top 3 DRGs. I give you 2 years to do it. Can you do it? What do you think? You know how gut-bustingly difficult that is to do? A couple of acid test questions. When I go to one of your community hospitals, is your ICU open or closed? When I look at the minutes of your P&T committee, can I order whatever the hell I want whenever I want? When you approve Provenge, $33,000 a dose, who's going to have access to it and for how long and for which patient? You're going to let any community urologist write a script for Provenge? $93,000 for one course of medicine that will prolong life if you have metastatic prostate cancer 5 months. Well, if you allow everybody to do that, you won't be in business in 2012. You won't have too much to worry about. So this is what the leadership issue under reform is really all about. Practice based on the evidence, work together, self-evaluate, close the feedback loop. It's not about insurance. Well, sure, that's the smokescreen. The real hard work is what we've been talking about here for the last hour. That's the real hard work of reform from my perspective. Okay, let's wrap up. I want to do one last thing. So here's the reform structure, and I don't think most people really appreciate that. All of reform is built on these sort of quality pillars. And let me show you, as you go to build your accountable care organization, possibly using Prometheus as your vehicle, moving from left to right, in the yellow, that's the current state. We just, pay people for reporting their outcome. Then we're going to have bundled payments, so you're going to have to figure out which resources to use. Then we're going to have bundled payments for chronic care in the office, not just the hospital. So the questions come up, which we don't have time for every detail today for sure, but so who's going to receive the bundled payment? Rick? John Burns? The board? The individual cardiology group? Kevin, who I had breakfast with? These are tough questions. You best believe that every hospital system believes the hospital should receive the bundled payment and that the hospital should lead the accountable care structure. I'm not convinced. Maybe. But I do know one thing. It's going to take unbelievable leadership to go from left to right. Left being the status quo, right being any aspect of being accountable for what it is we do together every day. That's the real message. It's going to take unbelievable amount of hard work at the leadership level to bring everybody on board. And that, I think, is really sort of the main message. Okay, let me leave you with a couple of fun things. And I do appreciate, again, my 4th visit with you all and sticking me right before lunch after Captain Mike. I'll find a way to get back at you, don't worry. But a couple of things to think about when you build that new medical school. Here's the medical student of 2010. Here he is. You know anybody like this? So Rachel Nash is a first-year medical student at GW Medical School in Washington. She picked the nation's most expensive medical school. Just for spite. So here he is. Last year I had a guy come, young house officer, come on rounds with me with a baseball hat. Backwards. Now, I'm not that old, but I said, you're not wearing that baseball hat when we go in to see that patient. What's wrong with that, Doc Nash? I said, well, I'll tell you what's wrong with it. You're not on my service if you're going to wear that hat backwards to see anybody. And it was like we had a confrontation in the hallway. And then you're in trouble. The medical students are hiding. They don't want to see what's going on. Bloodshed is about to occur, so they're diving under the furniture. And I said to the intern, who was only like 2 years older than the medical, I said, well, what are we doing here? You can't wear that baseball hat into that patient's room. What if that were my mother? She wouldn't appreciate that baseball hat. This is kind of what we're up against. How about duty hours? Well, any of the training program directors who are in the room, you know, guess what's coming our way? Even fewer duty hours. How are we going to make that work? You know, we're the only profession that argues, is 80 hours too little? And, you know, we'll fight to the death over that. So, time for Dr. Next. He's coming your way. And then, of course, you know, we already talked about this. The doctor will text you now. Rick, I won't take a quiz, but if I asked a board member to explain the difference between email and texting, do you think they could do it? Or what is Facebook? Or what's Twitter? Now, you know, you and I, we giggle. But, man, that's a social force coming healthcare's way we are totally unprepared for. Totally. My kids will not talk to another kid till they have Facebooked them. And it's going to be the same way about going to the doctor, going to the hospital. Unbelievable. We got a whole new way of thinking. We've already covered that. Okay, let me wrap up. So here's that slide again. Where's Spectrum on this vision? Where are you? I hope that you're thinking about getting to that third tier of crossing the quality chasm. That's where I think the real challenge is going to be to make this all work in the future. And let me leave you with one thought. This will be my last slide. So we'll come back to where we started. This is the Jefferson School of Population Health, the only such school of its kind in the country. We offer 4 degrees, the sort of bread and butter Masters of Public Health in person at night on our campus. But we have 3 other degrees, all online, the only school to offer this. A Master's in Healthcare Quality and Safety, that's right, one of 3 in the country and the only one online. A Master's in Health Policy, and this handsome young woman on the far right, a Master's in Chronic Care Management. Why? Punchline, I'm committing the last part of my professional life to creating the leadership team that's going to meet the challenge that we've just spent the last hour on, because you all remember the 1969 height of the Vietnam War bumper sticker? I do. It was on my loose leaf binder in 8th grade. And it read like this: if you're not a part of the solution, you're automatically a part of the problem. Thanks very much, everybody. Thank you.